Hey, thanks for taking a little bit of time to watch this video. I got inspiration for this video talking with a client this week, and I just wanted to lay out the framework that we use here at Resilience that allows us to get really good results with our clients, and maybe explaining why, if you've been in pain for a long time and haven't gotten the results you've been looking for, this may give you a little bit of a window as to what might be missing. So whenever we have a client come in, one of the most important things we can do is do a really thorough examination right off the bat. And that covers a lot of different things and can get us pretty close into the ballpark. But there's a saying in medicine, it's called practice. And sometimes we don't get it right on the head. And so what we do is we take the findings from the initial examination and then we come up with some hypotheses. The better we get, the more likely it is one of our first couple hypotheses, but sometimes, the driver of the pain or the issue isn't necessarily one or two, it's three. But the fact that we're thinking through multiple things, that there's multiple potential issues on the table that we can address is really important. And we just take a look at them systematically. And here's how we do that. So client comes in for an exam. We have a few different ideas as to what might be going on, and we want to make sure that we rule some things out, rule some things in. And then what we want to do is we want to give some treatment. And that's depending on, our clinical judgment and what we've seen historically, but that can be anywhere from exercise, nerve exercises, stretching, that could be dry needling, that could be cupping, that could be joint work, that could be soft tissue work. It could be a lot of different things, and that's always tailored towards the initial examination. But at the end of the day, we try something, and we figure out, does that make you better or does it make you worse? Ideally, we get you better, but if not, I don't think it's the end of the road because it does give us some information. So in the case that it actually makes the client worse, well, we have to ask, was it the right dosage of treatment? Did we do too much? Did we do too little? And sometimes we'll just double back and do the same treatment again, depending on what the response is. In other cases, we say, well, let's abandon this and let's go to the second hypothesis and see what happens. And so we start to take a look at this hypothesis, we do some treatment, and then the patient gets better. Okay, great. We're definitely onto something. So this is kind of the general framework that we use here at Resilience Physical Therapy. And as you can see, there's a couple different variables that pop out. I wrote T and P up here. The T is for time. Now, ideal world is we get somebody in the exam room, we get a hypothesis down, we do the first one, we treat it, and we get the client better. Totally happens. Sometimes it takes more time than that. There's also a process behind it. And often what I see is clients come from other places, or they haven't gotten results that they're looking for. And the general theme that I see is they go in for an exam somewhere else and the person jumps straight to treatment. And again, sometimes that does get the client better, but sometimes it doesn't. And the problem is when the patient doesn't get better, well, then what do? You don't have any other hypotheses to go to. So this is just a little video outlining this whole thing. And I hope that you found a provider that does both of these things, that gives you enough time and gives you a process that you can both follow and track. Because then you both know that you're on the right track and you're thinking the same way. So hopefully this is helpful. Reach out if you have any questions. Thanks.